Anti-wrinkle treatment, the first injection method of glabellar lines. How much do you know? Hey guys, welcome back to my channel. I'm Judy. In the last video, we introduced 3 treatment methods for forehead wrinkles with botulinum toxin. Today, we are mainly introduced the glabellar frown lines like the last video. Today, we also take 100U botulinum toxin product diluted with 2 mm or normal saline as an example. First of all, we need to know how frown lines are formed. The main reason is that the 3 muscles of the glabellar complex move, so the frown lines are formed. It should be noted there that the same muscle has different depths in different positions. When we frown, we can observe the range of the frown muscles. From the bow to the middle, the brown. In the position of the bow, the muscle is attached to the bone. The closer to the middle of the bone, the shallower the attachment position. In the middle of the eyeball, this muscle is attached to our skin, which is why we frown. There will be a small pit in the middle of the eyeball, which is caused by muscle stretching. So the same muscle has different depths. This requires that the bow injection need to be deeper, injected into the surface of the bone, and the position in the middle of the bow should be slower, and subcutaneous injection can be done. Let's look at the picture on the screen. When frowning, there will be 2 vertical lines in the middle, which are standard frown lines. Today, we are mainly explaining the treatment of standard glabellar lines. There are exceptions to everything. Some special glabellar treatment method I will talk about in my next video. Next is focus on our video. How to choose the injection point. Let's take a look at the punctuation on the picture. These are 7 points. Normally, 5 points is enough, but if you are looking for a good result and have a longer duration, 7 points will be better. 3 points on each side plus 1 point in the middle. First, determine the point in the middle. Its position is on the line connecting the bow and the inner corner of the eye. The point where the 2 lines intersect. The second point is on the upper part of the bow and a little leaner. Note that it is not directly below. This point is slightly above the bow. Next, determine the outermost point. Make the customer frown when determining. Observe the small pit that is put out. Draw a point on the place of the small pit, and this is the position we need to inject. Finally, determine the middle point at a point between the bow and the outermost point. The fixed point method on the upside is the same. Remind you to pay attention to the depths when injecting. The depth of these points is different. Note that the middle point, the 2 points on the bow are injected on the periosteum, which required the vertical injection. When injecting, if you feel like the needle has touched the bone, back off a little and then inject the remaining 4 points are subcutaneous injections that do not need to touch the bone. The injection volume at each point is 2.U. The injection point and dosage can be adjusted according to the actual situation of the patients. In addition, it is best to let the patients lie down when injecting to prevent the liquid from spreading to the eyes. The above is the introduction of the treatment for the standard of glabellar frown lines. In the next video, we will introduce the treatment for the specials. Don't miss it. Focus on the aesthetic, focus on your need. I'm Judy, your trusted partner.